Good afternoon, good morning, or good evening, everyone, wherever you may be based at this time. So welcome to our webinar entitled Community Engagement in Humanitarian Action. What does nothing about us without us mean? This is hosted by the Humanitarian Governance Project here at the International Institute of Social Studies, Erasmus University, Rotterdam. So as we will be discussing to you in a bit, this is a special episode of the HumGov webinar series because this is done in collaboration with UNICEF. And of course, I would also like to acknowledge Fiocruz and Makerere University, who have been our partners in making this event possible. My name is Kyra Zoe Cañete of the HumGov project, and I will be moderating our webinar today. I'd also like to acknowledge my teammates, Hyunggun and Gabriela, who have also joined us here today. So before we provide the rationale for today's event, I would like to go over some housekeeping so that we can ensure a smooth flow to our very interesting discussion today. So today's webinar is scheduled to last 1.5 hours, including a Q&A. I would like to request all attendees to mute their mics so that we can enable a panel discussion without much interruption. You can also use the chat feature to communicate to the moderator, me, or each other during the discussion. You may also use reaction features to express your feedback to the speakers. And during our Q&A, please use the raise hand function to be acknowledged. And alternatively, you may also use the chat for questions. And again, I'd like to reiterate that this webinar is being recorded, and it is also simultaneously being live streamed at the Fiocruz YouTube channel. Okay, so why are we holding this webinar? So community engagement is really one of the central concepts in humanitarian action in recent years. So there has been much concern about the need for quality and accountability and placing affected people at the center of humanitarian action. However, different contexts and relational dynamics between various actors and affected communities have produced different practices as well as challenges in engaging with communities. So the HumGov project, which is financed by a European Research Council advanced grant, has a special focus on civil society actors and crisis-affected people and how they shape humanitarian governance by using accountability and advocacy. And these issues have been a subject of our past webinars as well. So for this reason, we were very excited to partner with UNICEF, particularly with their Social Sciences for Community Engagement in Humanitarian Action project on a webinar series that highlights the tensions as well as lessons surrounding the project and practice and ethics of community engagement. So this is actually just the first of a series of webinars, and so we're very happy to have you all here with us today. So in this regard, I would like to hand the floor to Fernanda to give us from UNICEF to give us a brief description about their initiative as well.
Thanks very much, Kaida. Thank you so much, and thanks everybody. Can you hear me well? It's okay. Yeah, sorry. Just wanted to give a brief introduction, explanation about the Social Sciences for Community Engagement in Humanitarian Action project. This is a project that was convened by UNICEF, but we are working currently with more than 70 partners that include humanitarian practitioners, civil society organizations, and researchers from academic institutions. The idea of this project, the goal is to work on a collaborative way to strengthen global and regional demand and capacity for social science integration into humanitarian programming to ensure engagement of affected and at-risk communities throughout the humanitarian program cycle. And this is very important. We work really close and in connection with the humanitarian program cycle, understanding response, preparedness, and recovery phases, and how social sciences can fit into each one of these different stages. Of course, the focus is to support, responses, of course, as well, humanitarian responses, in a very adapted, rapid, and increase the effectiveness and efficiency of humanitarian emergencies. For this, the project focuses specifically on the development of global goods in this collaborative manner. This is very important. This is not a one-sided UNICEF project. It's a collaborative effort with voices from, as I explained, different sides, the North and the South included. So we work on and reflecting, the process is very interesting process, on the reflection on the ethics and data sharing guidelines and code of conduct for the application of social sciences for community engagement and humanitarian action at the different stages, as I explained before, in linkage with the humanitarian program cycle. We also work on capacity development, understanding what exists in terms of trainings and capacity development specifically for the application of social sciences. And also we're looking at data systems, community engagement data systems, tools, and guides. First, in all these three elements, we are looking at what already exists. We look at processes that are ongoing. We look at structures that existing today, and we try to be embedded in those either processes or structures. We do not want to create a parallel system or work on isolation, on what we call a navel-gazing exercise on social sciences, looking at that only. But we want to be merged. We want to be embedded in the humanitarian system and the structure as it functions today. Of course, this means understanding all the challenges and criticisms that are currently ongoing with, for instance, the decolonization agenda and all the criticism that that brings. So we are bringing that agenda as well in the elements that we're working on. We want to look at those aspects of the global North and global South relations and decolonization of research, decolonization of humanitarian aid, the understanding of all the processes that are behind and how this project can contribute, to this. But again, as I said, systems approach, understanding the humanitarian system, being embedded and looking at how we fit into those processes, but always with a critical look and looking at how to, let's say, I don't like to use the word empower, but how communities can play the role that they should be playing and get to this even ownership of humanitarian responses in all the project cycle, of course, and the program cycles for humanitarian aid. So thanks very much, Kaida. Please go ahead.
Thank you so much, Fernanda. So just as a note that this is still the first of our series of webinars, and I hope that everyone will stay tuned to the other succeeding episodes that we will also have. So now the main part of our webinar, it's my pleasure to introduce to you our panel of speakers for today. And we're really thankful to them so that they can, they give us their time to share with us their insights and experiences drawn from their work in different humanitarian contexts, from HIV/AIDS struggle in Brazil to community engagement in humanitarian responses in Latin America and Uganda. So our first speaker is Professor Richard Parker, who is Professor Emeritus of Sociomedical Sciences and Anthropology and a member of the Committee on Global Thought at Columbia University in New York City. He is also the Director and President of the Brazilian Interdisciplinary AIDS Association, a leading non-governmental AIDS organization in Brazil. He's also a founder and co-chair of Sexuality Policy Watch, a global coalition of researchers, policymakers, and activists from a wide range of countries and regions, with secretariat offices in Rio de Janeiro and New York City. So he's also founder and chair of Global AIDS Policy Watch, a knowledge network and policy watchdog initiative on the global HIV pandemic. Our second speaker is Deepa Victor. Deepa has expertise in developing community engagement strategy through participatory processes in the humanitarian context. She has worked in community-based projects in India for over 20 years before moving to international projects. Deepa's last assignment with Médecins Sans Frontières was in Latin America, supporting projects in migration route from Panama to the US-Mexico border. And last but definitely not the least, our third speaker is Associate Professor Paul Bukuluki of the Department of Social Work and Social Administration, School of Social Sciences, Makerere University. He is a social worker and medical anthropologist with more than 15 years of experience in implementation research in the fields of gender norms, social norms, sexual reproductive health and rights, and violence against women and girls in development and humanitarian settings, particularly in Africa. He's a member of the Global Learning Collaborative on Social Norms and the East Africa Learning Collaborative on Social Norms. Again, we welcome our three speakers, and without further ado, let me call on Professor Richard Parker to discuss to us his work with the Brazilian Interdisciplinary AIDS Association.
Thanks very much. I want to thank the organizers, all of you, for the invitation to participate. It's a pleasure to be here with you. What I'm going to try to do very briefly in about 10 minutes or so is to talk a little bit about the work and the experience that the organization that I direct, the BIA, the Brazilian Interdisciplinary AIDS Association, based in Rio de Janeiro, Brazil, to talk a little bit about our experience over 40 years now of HIV and AIDS, and to try to highlight some of the things from that experience that might be useful to others in terms of thinking about this field. As a point of departure, I just wanted to start by emphasizing what may seem obvious, but what I think is important for us to stress. Context matters. Any kind of response in terms of humanitarian emergencies and community engagement requires us to think seriously about the context that we're working in and how that affects the possibilities for what we can do. I think from my perspective, trained in social science, there are probably 4 or 5 different aspects of context that it's important for us to look at. Historical context is very important, as much of what I will say will emphasize, but also social, cultural, political, and economic context. And sometimes they're all mixed together and it's hard to sort out what's cultural, what's social. I don't think we need to worry too much about that, but we do need to be sensitive to what are the kinds of contextual factors that affect the possibilities for what it is that we can do. So in terms of historical context, a few words about ABIA's history that I think help to understand what ABIA has done over time. ABIA was founded in the mid-1980s, just a few years after the first cases of HIV and AIDS were reported in the world and in Brazil. It was a period known as abertura in Brazil, of opening after 20 years of military authoritarian dictatorship. It had not yet returned to full democracy. Democratic direct elections would only happen in 1990, but in the mid-1980s, when ABIA was founded, we were already moving in the direction of the return to democracy. And that was especially important because, first of all, there was still no response to AIDS. And in that sense, I think we can think of AIDS in Brazil at the time as truly a humanitarian emergency. No governmental response, no organized community response, no interest on the part of international agencies or philanthropic donors. So it was really a crisis for anyone who lived with HIV at that time, when there were no medical responses that could be helpful, and virtually nothing in terms of any kind of organized structures that could help people to confront the epidemic. So social mobilization of all of those sectors, government, non-governmental organizations, international organizations, foundations, and philanthropic donors, were very mobilizing those spaces to respond to the epidemic is a lot of what we did during the first 5 to 10 years of ABIA's experience. And over that time, redemocratization in Brazil did move forward and deepen. And that was especially important to give us an emphasis on issues like solidarity and social justice and human rights as fundamental issues for thinking about the questions of AIDS, because they were so tied up with the whole process of the redemocratization of Brazilian politics and Brazilian society. A second point that I think is important from ABIA's perspective is we work in terms of making connections, and there are two kinds of of types of that are important to us. Intersectoral, on the one hand, we bring together civil society with government administrators, service providers, academics, and try to get different sectors of society to talk to one another, to enter into dialogue about the issues that we're concerned with working with. But we're also intersectional in the sense that we work with multiple populations and the ways in which their situations crisscross and intersect in terms of social inequalities, and stigma and discrimination. We work with people living with HIV/AIDS. We work with gay, bisexual, and other men who have sex with men. We work with women. We work with Afro-Brazilian communities, school-based publics. We work with shantytown, favela communities, and with workplace publics, and making the response to AIDS a response that isn't limited to any one of those identity groups, but that builds bridges between them to create an intersectional response was one of the key priorities that ABIA had over time. We also had to build communities because when AIDS emerged, many of the communities that AIDS affected didn't necessarily think of themselves as communities. It was the early days of the feminist movement in Brazil, so it was just beginning to organize. At the very start of an organized LGBTQI+, community, and building those communities to be able to respond to the epidemic was one of the fundamental things that we spent much of our time trying to do. We also tried to work with them to develop fundamental ideas of how communities could respond to the epidemic. And I always like to remind people that concepts like safer sex and harm reduction, which are still 40 years later, the most important tools that we have in terms of preventing and responding to the epidemic, weren't concepts that were created by experts. They were created by affected communities. So the idea that there's no response for us without us is fundamental here, because indeed community responses were the most effective responses to AIDS, and they still are. And a lot of the time the experts have gotten it wrong and moved in directions that haven't been in tune with what communities want and what communities need. So understanding those connections to the community is fundamentally important. Over time, as the response developed, as AIDS stopped being such an emergency because there were medical treatments became available, government programs got set up, ABIA's work moved very much into monitoring those government responses and trying to help affected communities to be able to be good, to be able to monitor and be able to advocate for their own needs. And so creating dialogue that would help communities to continue monitoring was fundamental. I think I'm sort of out of time. I'll just mention two things, and we maybe can talk more about this in the conversation, the discussion. In the past 10 to 15 years, we've also developed special programs around treatment access and treatment literacy that has developed programs because treatment is complex. And so for communities to understand treatment, they need to educate themselves. And so we've developed programs that works around building treatment literacy. And we've also worked in Sexuality Policy Watch around programs that monitor sexuality policy and try to develop community-based participatory research methods so that communities can themselves monitor those issues. I'd be happy to talk more about that during the discussion, but my time is up for now, so I'll stop here and thank you for your patience.
Thank you so much, Richard. I think it's very clear from the presentation the importance of really being mindful of context, historical, social, cultural, economic, and political context, and also look at engagement as something that's also intersectoral, intersectional, and dialogical, looking for building spaces of connectedness in order to build that struggle around rights. So thank you very much, Richard. So now to talk about MSF's experience in community engagement for improved patient care in the migration route in Mexico and Panama, I'd like to welcome again Deepa Victor. Deepa?
Hello. Hi, everyone. My name is Deepa, and I apologize at the start. My camera, for some reason, is not working. So you will have to just make do with the audio. Really sorry for that. I want to share with you my experience in Latin America. For the last 1.5 years, I was based in Latin America, and we worked in the migration route across different countries. So from Panama in until Mexican border. And what within the space in MSF, community engagement is a very important part, because we see it as one key way for reaching the community, for providing patient care in the most effective way. But how do we reach a community which is constantly changing? Because unlike any other humanitarian sector, place in a crisis, the community is in a place. Maybe they are an IDP community, but they are in one place. But in the migratory route, the community is constantly moving. They walk every 4-5 days. They come to a place, rest for maybe 24 hours to 48 hours, and then they move again. So what does that mean for us in terms of engagement? Here we have a community that is not static. The challenge comes in there. So can we actually engage? And why should we engage? Some of the biggest challenges when it comes to that is also not just the community is moving, the profile of the community is constantly changing. What does that mean? The migrants, maybe for the next 4 or 5 days, you have young, healthy men walking, and they don't really stay for too long in any place to rest because they're young and healthy and they're on the move. And then in a couple of days, you could have large groups of families with young children. And they, of course, move at a much slower pace. You have to move only as fast as the slowest member in your family moves. And that makes, it's a whole different community profile then. Or sometimes you have large number of younger single women, and that's a whole different challenges. So the community is constantly moving, the community is constantly changing. And the other thing is, almost everybody has personally experienced or witnessed extreme violence, including sexual violence. So this also makes them very fearful. They are traumatized when they arrive at any place, because the migratory route is normally people have specific places where they come and stop, rest for a few days, and these places typically have some kind of a organized shelter space. As a result, that's the place they come to. So when they arrive, they're tired, they're traumatized, they're fearful. Seeking medical care is not at all their priority. They're looking for a place to find a place to stay, to sleep, to wash. And, so in that situation, how do we engage? And not to mention, a lot of them come from different countries. So language is again a challenge. I spoke close to 4 or 5 different languages in any given day, depending on the country of origin of the migrants. So for us in MSF, the objective of engaging in that context was very clear. How do we build trust so that we can actually be able to help and provide medical care and mental health care to as many victims of violence as possible, and provide information. Information on what? Information on what are their rights within the country, what services are available, and then teaching them the map. Most of them don't know how big Mexico is, how many more days they need to walk. So we have little maps. So engagement is on in extremely fast-paced. It has to be very well organized, because you have to take one look and have a quick profile of the migrants for the day. All right, today most of them are coming from X country. This is the age group. This is the route they have taken, which means how do I engage with them? And some of the key learnings that we had in this very specific project was have to be constantly thinking out of the box. No plan ever works. The plans are constantly changing, have to be creative. And how do we, and on an average day, we could have between 400 and we had up to 2,000 migrants on a daily basis coming in. So you could have about 400 to 1,000, 2,000 migrants entering, staying for 24 hours, sometimes less, and then leaving. So that's a huge population coming in. There is no one place they come and stay. It's they're on the roads, they're in some shelters, they're in other people's houses who are renting out space. So it's a very spread out community. And even here, if you see the one of the key things that we learned was when we decided to be very creative, how do we engage? How do we inform? We started networking with the other organizations, informing them about sexual violence and why the first 72 hours is key for medical for medical needs. So we started doing quick trainings with anybody and everybody. So we were talking with, the woman who was selling food on the streets, talking to her about why sexual violence is a medical emergency, why the first 72 hours are key. We were talking to the shopkeepers who were selling knickknacks, who were selling mobile phone connections. We got creative in engaging as many different people because we were mapping places, where are the people going to, and engaging with them. So the idea being that the more people we engage, they can then, as and when they have opportunities, they can share with the population. When group of people are sitting and eating, there's a group of women sitting there, a group of men, talk to them, at least inform them. There is the MSF mobile clinic, and hey, if there is somebody with XY needs, it's important, you can go. So we started, engagement for us became truly out of the box creative thinking. And again, maps. We had printed small maps, and we just had teams of people going out and showing people where they are, where they need to go. And we had mapped out all the services from the south of the border all the way to the northern border. Services, where are the health centers available, the government health centers, the other organizations-led health centers, where are the shelters available, which routes take you to which place. Everything had been mapped out, and then we took time to explain to people about just the maps. So they had something in their hand and numbers. Go to here, you can call up this number, So engagement became for us in every way, how do we reach people in a very short amount of time to be able to provide them with as much support as we can. The other thing what we did was, how do we engage with such a diverse group of people, which was one of our biggest challenge, because we cannot talk to somebody from Honduras the way we can communicate with somebody from, say, Cuba or Venezuela, because the level of education could be very different. Their experiences back home could be very different. So how do we engage in a way that is culturally appropriate, which is also gender specific? How to talk to a man, how do you talk to women? So we actually started collecting information on a regular basis and then built narratives. When you're talking to somebody from X country, depending on their gender, these are the words to use, these are the way to talk, this is the information to give. And that was truly helpful for us, we realized, because when we speak in the language that the person understands, one, we show them the respect. Two, they are able to internalize the information and then ask for help. And that was a big learning for us, to do a cultural assessment on the go and how to build narratives. So lastly, that has been my and MSF's experience in LATAM. It's still ongoing learning experience. We're still learning a lot because things are still changing. It's a very dynamic project. So a lot more to learn. And thank you so much for the time.
Thank you very much, Deepa. I think there were a lot of really interesting highlights in what you just shared. For instance, the complexity of what it means to do community engagement when we factor in mobility as well as diversity of people that you encounter on a daily basis, right? And it was really insightful for you also to share some of the strategies that you put in place in order to deal with these challenges. Last but not the least, I would like to call on Professor Paul Bukuluki to share with us his experiences and reflections on community engagement for prevention and response to gender-based violence in humanitarian settings. Paul?
Thank you. Sorry about that. I would like to build on what my colleagues have already mentioned around emphasis on context, around the emphasis on complexity, around the emphasis on relativity as we work in humanitarian settings, especially as we work on sensitive subjects, for example, like sexual and gender-based violence. And I'm giving my case study on Uganda, which is actually in Africa, the country that hosts the largest number of refugees, about actually 1.5 million refugees, according to the most recent statistics. And in respect to community engagement in this space, I just want again to underscore that at least theoretically, we have seen a shift from focusing on service delivery that is prescriptive to one that is more holistic in terms of engaging with communities, looking at them as active agents of their own protection in respect to GBV, and as active participants in prevention of gender-based violence. And here I would like to speak especially to the clear distinction that is emerging between holistic and prescriptive approaches. And I give credit here to John Paul Idrak, who innovated this concept of peace building from below and ensuring that people are actively engaged to promote both individual and collective agency and locally led initiatives in the context of community engagement. And I just want to highlight the fact that what I've seen emerge over time, and this has been sort of an evolution, is that I have seen that the community engagement approaches increasingly now draw out and highlight and catalyze existing communally held knowledge related to understanding of social norms, gender norms, root causes of GBV, in order to ensure that people own and become active agents within the process of community engagement. And I will give you some examples to highlight this. For example, some of the programs now have what are called community advisory boards. And the community advisory boards comprise of religious leaders, social workers, traditional healers, village leaders, refugee and host populations. And by doing this, they are trying to make sure that the different groups within the host population and refugees are being represented in the process of community engagement. One of the programs that is very interesting is what is called the youth pyramid structure that is being implemented in some of the refugee settings in Uganda, especially in Western Uganda and the Northern Uganda, where which involves training younger people who reach out to communities through door-to-door processes and engaging their peers, whether these are men, women, boys, or girls. And the other very innovative community engagement approach that I can speak about that has been published widely is the SASA approach, which basically operates using three phases, what they call the start phase, awareness phase, support phase, and action phase. And each of these phases has objectives to achieve, and it works alongside the socio-ecological model. And it helps people to identify the power within the community to stop and prevent GBV. And we have seen a number of publications on SASA demonstrating the power of community engagement, right from the individual level to the community level to the societal level, addressing the different risk factors of GBV, that the whole ecology of risk factors of GBV, and mobilizing the resources within the community to be engaged and to foster individual and collective agency. In most of the societies where we work, in humanitarian settings, these are collectivistic settings where it is not so easy to identify an individual because the individual feels part and parcel of the community. And this is where I relate to the concept of context that was used by Richard, that understanding the context is extremely important because you might be focusing on the individual agency, and yet the most important thing is actually to catalyze not only individual agency, but also collective agency, because people don't see themselves as separate from the community like it is in other settings. So, and also we have seen strategies such as male engagement strategies, having male action groups, also this building on the power within to be able to use peers, fellow males as champions in promoting GBV prevention and focusing. And one of the things that I could speak about in terms of context in Uganda is that through the comprehensive refugee response framework and what they call the refugee and host population empowerment framework, they have made sure that it is policy that if there is any GBV prevention work or response work happening, 70% is targeting refugees and 30% is targeting the host population. And by doing this, it has helped to reduce tensions between the host community and the refugee communities in terms of planning and delivery of services and in the community dialogues and engagements for prevention. One of the challenges that I see though coming up while working at the community level is that how do you address issues of complexity, because the community is so heterogeneous, the host population is heterogeneous, but also the refugees are heterogeneous. And then how do you make sure that you apply, for example, the concept of intersectionality, to respect the heterogeneity of identities and the simultaneously occurring risk and vulnerability and power relations that come with those different identities. And people might hold different identities. I could be a woman, but I'm young, I have a disability, and I come from one of the ethnic groups that is marginalized. So how do you embrace this complexity to make sure that there is social inclusion in terms of representing the different voices of the community and accounting for as a duty bearer to make sure that all these are engaged within community engagement. The other challenge, maybe the last one I'm talking about that comes up in community engagement often, is how do you do organized diffusion? Because you might target a certain number of people within the community, for example, the community dialogue meetings, but how do you ensure that that information flows to the other people who are not around? Because you cannot have a census, you are likely to have representatives, but how do you foster organized diffusion? I think organized diffusion of messages, of skills, of interventions is still nascent in this area of community engagement, and we need to do more to make sure that this is fostered. I want to thank you so much, but just to mention that the other one last thing that I see is also that there is still that siloed approach and divide between sort of what happens with the humanitarian settings and development settings, meaning that there is a laxity in terms of strengthening systems, and this can happen even in protracted refugee settings where it is not, people are not staying just for a few months, but it is protracted over years, but still the operations like people in emergency setting, and there is no focus on strengthening institutions, local government systems, building those systems to deliver community engagement programs. Thank you so much. Over.
Thank you so much, Paul. Gender-based violence really is one of the major concerns in humanitarian action. And as you have just discussed, there remains a lot of challenges and barriers to put in place effective programs. Among these are really understanding what are the norms that actually drive gender-based violence to be perpetrated. What do we need to understand as well in terms of the context in which these events are embedded in? And I think it really ties up well with the rest of the discussion from two previous speakers when we talk about the importance of context, intersectional approaches, and really trying to see it from the perspective of affected populations. So our speakers today have provided us with a lot of food for thought regarding community engagement, and I can already see that there are some questions that are in the chat. To help us chew on this food for thought, I would like to call on Rania Elaseri, Partnership Specialist, Community Engagement, Social and Behavior Change in UNICEF in HQ New York, to share with us her reflections on the presentations today. Rania?
Thank you so much, Kyra, and thank you so much to Richard, Deepa, and Paul. It was really interesting. Please keep your camera on, Richard. It's really good to have some interaction and see people's faces. So that was really wonderful. I have quite a few reflections, really from the theme that was basically running across a lot of the discussion points that all of you made, and I think the importance of contextualization came out clearly over and over. Not only about that, but the contextualization, and then what we mean by, and I put this in quote unquote, the systematic engagement of communities. I think there's always this crossroads, particularly when we speak about humanitarian action, about giving communities a role. Okay, but we do not impart on communities a role. They are already actively engaged. And I think one of the things that we struggle with as in systems, whether we are within the UN system or other systems, but mainly it's national partners and national entities that are responsible and that are organized and that are accountable for, the provision of services. When we're speaking about provision of services, I think one of the things that really stands out to me is the sustainability of that, though, and what do we mean by how service provision is then sustained? And in humanitarian crisis, we know very well that the first few hours are critical, the next 12 hours are another situation, the next 24 hours, and so on and so on. And especially if we start to speak about populations that are on the move, or IDP population or migrants, it's a completely different situation. The context, the cultural dynamics that Deepa spoke so well about are super critical. And so how do the institutions, the implementing partners, all of them that are organizing themselves to deliver community engagement, but what is happening in the community already? And that clear understanding around that is a challenge. Of course, again, that is relevant from like the intersectoral perspective, and then understanding the intersectionalities at the community level. So I don't want to repeat what you've already brilliantly talked about, and having so many different contexts as well as issues that you've brought up. I think maybe what we can go to is go into some of the questions. And some of the thoughts that I specifically had as we were listening to you. We do have one specific question from Constance, and it's more of a generic question. So I think we can start with that. And then I would love to share a few more reflections around the systems building and the accountability of national institutions and entities, because I think that is really what we want to land on. What are the recommendations and how to sustain these efforts? And the nothing about us without us, this theme that needs to be running through is to talk about accountability. And what do we think about accountability? So I'll start with Constance, because she asked a very good, very generic question, but saying, so how do you do community engagement? And how do you engage the community? And I asked her to elaborate around that. To what extent do you engage the community in a humanitarian response? So in an emergency context, for example, in an aftermath of a disaster, for example, a flood or a landslide, applying what all three of you have spoken to, how would you define community engagement within those contexts? And we can start with Deepa maybe, and then come back around to Paul and Richard.
All right. It's a good question. It's something that I have also asked myself many a times. It for what I would say is in an emergency, say there's a flood or there's an outbreak of a disease. The key thing is to understand what is the objective of engagement, because we cannot just engage for the sake of engagement in a setting that's changing by the hour, because it's a disaster setting. So let's say in the setting of a landslide, as you've suggested, I would look at engaging with the community to understand who are the most vulnerable people in their community. What is the mapping of their community? Where do people live? Because we're coming from outside. Maybe all I see is what's in front of me, but there could be communities way far behind that we don't know about. So understanding the mapping of the area, which place could be, maybe even the community has not been to that area yet. So we bring them along. Can we go check what is situation in that particular area, which was by the hill, and say 30 families were living there. So get the community involved to understand the geographic context. Try to quickly understand what is the community dynamics. Is there just one community or different tribes and different communities, and what is their dynamics between them? Because often in a disaster, the one that we see in the forefront as a community would be the ones who are the most powerful group within the community, because they're the ones who have slightly more money, maybe had better houses. So they're the ones out able to come and talk to us, to be aware of that dynamics, that maybe there are other members of the community who are way more vulnerable, would never come out up front and talk. So we engage to understand the power dynamics. We engage to understand the gender dynamics within the community. Maybe all the men are worried about the houses, but you talk to the women, they're worried about food, they're worried about safety of their women, they're worried about their children. So it's also important to listen to both genders. So in a disaster setting, as I said, engaging with the community to understand, not going in there thinking I know it all, to be humble, to ask, to learn, to listen, to observe the body language. Maybe somebody is speaking, you realize everybody is quiet and kind of slightly timid around that person. Maybe we should hear some other voices. Maybe this is the chief of the village, somebody with a lot of power. So those kind of things in a disaster setting becomes very important. And also informing them, what are the services available? Where can they go to get help for what? Where would they sleep tonight? Do the women have safety? Which is the best place to build a shelter? Is it in point X because that's the place closest to you? What does that mean to the most vulnerable member of the community? Can they come there? Or is it too far? Or is it near maybe a sacred place or a temple, or near the house of somebody who has way too much power in the community, so the other members of the community won't come there? So those kind of things in a disaster becomes very important to engage with, to understand these dynamics in the community.
Thank you, Deepa. Richard, Paul, would you like to also come in? I see Richard unmuting himself. Come on in, Richard.
I think one of the important questions also that we have to ask ourselves is how situations change. So there may be an immediate kind of response that's necessary after a landslide or an outbreak of an epidemic. But then the landslide has happened, but its consequences spread out over time in different kinds of ways and at different speeds. So there are fast moving events and there are slower moving events, and the kinds of things that are needed to ensure engagement may be different depending on where one is in the process. So I think I'd add process to context, perhaps, as two dimensions that it's important to look at. And then one other thing that, at least for us in our work at ABIA in Brazil, has been over a long period of time, has changed dramatically, is the political situation, political openness to the kind of work that we do. So as I mentioned in speaking about ABIA's work, it started during a period of redemocratization. And for at least 2 decades over the course of the 1990s and the 2000s, it was a period when there were quite progressive social democratic and socialist governments in place that were very open to community involvement and set up structures for it, set up commissions and committees that had participation of community groups. So there was an openness to that. We've just gone through a period in the past 4 years where we have an extreme right-wing government came in, and they dismantled all of the community participation structures that had been in place over a couple of decades. So that in those 2 different settings, we have completely different kinds of challenges in terms of how we go about doing community engagement. When governments were open to that kind of involvement, it was connecting up communities to the spaces that existed and that progressive government officials had created. Today, where governments have dismantled, they've literally ended all of the committees and the social participation structures that existed for communities. So we have a completely different kind of thing where we have to establish alternative kinds of spaces for communities to strategize about how they can pressure against the things that the current government is doing. So again, over time, I think the strategies that you need to follow to develop community engagement will differ, and you have to kind of go through an ongoing strategic analysis with communities to identify in partnership what are the key barriers and what are the key opportunities that may exist at any given point in time.
Thank you so much for that, Richard. Paul, please come on in.
Thank you. Just building on what my colleagues have actually provided as very good responses, that change is something very constant, and you have to adapt to changes in the situation, in the relationships between people, in the way the disaster is also, or emergency is evolving. And it is true that at that very acute phase, you may want to use the tools that you think have worked elsewhere quickly in order to save lives. But immediately, you must have the thinking of being accountable and not taking away the power of the community, but rather to harness that power and resources within the community, because you might want to swing in as an expert, showing power, and you drive with the locally led initiatives that exist because within the community, these resources exist, skills exist, indigenous knowledge exists, and the disruption by the disaster or emergency does not mean that these have gone away. These people, don't look at them as victims, as passive. You have to look at them as key actors. And I want to underscore the point of being able to initially read about the culture, at least respect the culture by reading about the culture, the context, such that you have something you understand about the context within which the emergency is happening, because this would help you to know the level of vulnerability and the relativity of risk and vulnerability for the different population groups, whether these are women or men or children, and it might give you a chance to reflect on the needs, on the dynamic needs, because they also keep changing depending on the level of the disaster. So I just want to underscore the fact that you need to be alert. You don't need to take over power, rather identify power within the people and work with that power and resources as you do community engagement. Thank you.
Thank you so much to all three of you. I mean, from my reflections, just to say that the main point that Paul probably summarized is do not take over power at community level. I hope that kind of sheds some light, Constance, on the question that you were asking. But more critically and concretely, I think all of you spoke about three very core things. One, that the community is a key actor, and culture is actually powerful and positive. It could be reflected in the way that relationships are at the community level and organic support mechanisms that are already existing that should be better leveraged. So that is really around the harnessing of the resources that are already existing in the communities. They already have skills and they have indigenous knowledge, and how do we leverage that more from a partnership perspective and working more closely with the communities. I think what Deepa really spoke to is being able to understand those power dynamics, though, because sometimes those that are powerful at a community level are not representative of all the community needs and dimensions, especially more vulnerable populations. And then to what you spoke to, Robert, I couldn't agree more on the adding process to context and this context of political environments. You're 100% right, because I think that we're seeing that sweeping all over the world. It's not just in Latin America or just Brazil. And the impacts of systems and structures and how communities are actually connected to influence decision-making processes, which actually influence then the services and the conditions that are either responsive or more accountable to the interests of communities at the community level. And I think that that is a very critical factor, because I think when we think about community engagement, the critical point is the investments that go into community engagement, not the investments that are in the government's pockets or in the humanitarian organizations during a crisis and how that's steered towards community engagement or not, but more at how do investments trickle down and go directly into supporting skills building, partnerships, coalitions, networks that are already existing at the community level that require resources to sustain that. It's not all a volunteer effort. This is time of people. So thank you so much for that. And maybe I'll go to the next question. It's great. I don't even want to try to say the name of the colleague that put this because I won't say it correctly, but thank you so much for your question. And if you want to add to it, but I will read off the question that was in the chat box. And the question talks about actually the humanitarian actors and organizations accountability. And the question is, when and under what conditions do humanitarian actors and organizations fail to steer or guarantee community engagement in humanitarian interventions? So who would like to kick us off? I saw Paul turn his camera on, so maybe we'll start with Paul, then we'll come back to Richard. Yeah. Paul, please come on in.
So for me, it is when they think that they know it all, when they think they come in with the perspective of being experts, when they don't come in to learn from the communities and enhance the local agency, whether it is individual or collective agency of the communities that have been affected by the disaster. Once they do that, once they take over, then there is no accountability. But two, when they don't foster building systems and institutions that are available in the community, and also when they don't work with the community structures, because it will mean that no sooner do they leave, do they exit, then everything is gone. So that is really not being accountable. If you are only coming in, it is like taking somebody in the middle of the sea and you leave them there because you have not engaged them in the process. So that is the biggest challenge in terms of failure to being accountable. Thank you.
Absolutely, Paul. Thank you. Richard, over to you.
I think we probably all are in significant agreement here, and I would underline everything that Paul said makes complete sense. And the greatest error one can make, it seems to me, is to assume that somehow you're an expert and you know the answer to things and just need to transfer your knowledge to other people. It's you're guaranteed to fail in what you're doing if you try to create engagement that way. And I think at the end of the day, most of us probably would sign on to a kind of a Paulo Freirean approach to the against the idea of a banking notion in which you feel like you have the answers and you put them into the empty heads, the deficit bank accounts of the people you're working with. On the contrary, knowledge needs to be constructed and produced collectively, and the people who are most affected always know more than anyone else does about what it is that affects them. Sometimes there are barriers to their being able to verbalize that or being able to interact together collectively about it, and so it becomes a question of can you create structures which make dialogue possible so that together you can create understanding of what it is that needs to be done. I think doing this kind of work requires a constant exercise in humility, and if we fail to do that, we fail. We fail in working effectively in humanitarian responses.
Thank you, Richard and Paul. I completely agree with both of you, what you shared. And to me, I always say it's also important for us to know, why are we engaging? Are we engaging because I need to write a report for my donors, or because I am this great humanitarian, so I'm engaging, or I'm here because I'm here to feed my ego, or I'm engaging genuinely because the people, they have systems and I need to build them up, help them build them up in this time of a humanitarian crisis. So it's why are we engaging? Is it because we respect the population, we respect the community, or is it my own ego or my need to, satisfy my supervisor, my donor? So the why is very important when we're engaging.
Thank you so much. Yes, again, couldn't agree more. And I'm actually looking at colleagues that are on the call, if there are any of the colleagues that are actually working in humanitarian organizations. Please feel free to raise your hand and also share your reflections to what the colleagues are speaking to, because maybe just on one point, I fully agree. And I would put another dimension on how we actually deliver community engagement during humanitarian intervention. And because humanitarian organizations receive a lot of resources, and what Deepa, what you said is, why are we engaging is super critical. And the way that humanitarian action is organized, we burden the community over and over and over and over with the multiple dimensions of the humanitarian response, under the guise of wanting to deliver community informed, because I would actually say it's community informed, not community led humanitarian action. And so there's a very important distinction between community informed versus community led and driven, and absolutely sharing power, because we parachute into spaces that are already existing and are quite strong. So we should capitalize on that.